Imagine you're skateboarding. You fall and sprain your ankle. It hurts, so you don't want to walk on it. As you wait for a ride home, you wonder, what would life be like without pain? Pain is protection. It's like a built-in alarm system that tells us when a behavior is harmful or when something's wrong inside our body. Protective pain is also called acute pain. It starts from a specific cause and goes away when the cause is gone and the injury heals. Pain signals travel along pain pathways in the body. Danger-detecting sensory neurons start the pain message. The sensory neurons connect to neurons in the spinal cord. The signal is relayed up through the spinal cord to the brain. This upward pathway is called the ascending pain pathway. Once the ascending message reaches the brain, it's translated and we feel pain. But pain is a complex experience. Many inputs come together to determine what we feel. Sensory areas of the brain process information about the injury itself. Other areas process emotional information, like a person's past experiences, plus their current setting and mood. Emotions influence how unpleasant pain is and how much attention it's given. After interpreting the pain message, our brain directs signals back downward. One downward signal connects to muscles. It causes a protective reaction. The other downward signal travels along the descending pain pathway. Its job is to slow or stop the original ascending pain message before it gets to the brain. The descending pain pathway connects to the ascending pathway in the spinal cord. It's like a brake system our brain can use to control the intensity of what we feel. Our pain pathways are set up to allow a different response in certain situations. You may need to escape a dangerous situation despite pain from an injury. When a woman gives birth, she has to persevere even though it's painful. Athletes often don't notice bumped elbows or scraped knees until the heat of competition is past. When pain isn't useful, our bodies produce their own painkillers. They're natural opioids called endorphins. Endorphins have different effects in many places throughout the body. In the spinal cord, they influence pain. Endorphins directly block pain signals in the ascending pathway. Pain messages don't get to the brain. Normally, there are signals that prevent activity in the descending pathway. Endorphins block these signals. The descending pathway becomes more active and puts the brakes on the ascending pathway more strongly. Fewer pain messages reach the brain. Sometimes our natural painkillers aren't enough, and we use medication to stop pain. This is especially the case for very severe or long-lasting pain that no longer serves a protective purpose. Opioid drugs are one example of a pain medication. They work just like your body's endorphins, blocking pain messages from getting to the brain. But the effects of opioids are stronger than those of endorphins. Endorphins are quickly inactivated, while opioid drugs last longer. And while at least some endorphins are made and released only where they're needed, opioid drugs act across most of the body. Endorphins do affect processes outside of pain management, like mood and reward, but opioid drugs have many more side effects. Some, like effects on breathing, can be quite dangerous. Opioids are just one of the many medications used for treating pain. Each works in a different part of the pain pathway, and each has its own way of stopping pain signals. That's why some painkillers work better for different people or for different types of pain. NSAIDs, like aspirin or ibuprofen, work by preventing cells from producing compounds called prostaglandins that promote pain signals at nerve endings. Local anesthetics, like lidocaine, temporarily block sensation of all nerve fibers, pain and others, in the area in which they're applied. Acetaminophen, Tylenol, is believed to prevent production of prostaglandins in some tissues. Prostaglandins are compounds that promote pain signals at nerve endings. Acetaminophen may also work to block pain signals directly in several places of the brain.